Hello and welcome to Mother Tongue, the podcast where modern motherhood meets real life. I'm Marianne, founder, podcast host, and mum of three, and I created this space for all the mums who are juggling it all. From toddlers and tantrums to businesses and burnout, we're talking about what it actually takes to build a life, a career, and a family all at once. Here, you'll hear honest, unfiltered conversations with founders, freelancers, experts, and everyday mums about work, wellness, identity, mental health, relationships, and everything we carry that no one talks about. Hit follow, join our community, We Are Mother Tongue, and tune in for real talk that supports the whole you, because modern motherhood is busy and no one should do it all alone.
We are so incredibly excited to welcome two amazing guests today. We've got Dr. Maria and Jacqueline, both from Mediclinic, and we are going to talk all about postpartum body, healing, hormones, and beyond. And moving on to exercise, at what point do you think people should come and see you postpartum, and when should people start looking into kind of that rehabilitation process and connecting with their body again through breath and everything else before they start getting into full-blown exercise? Like when roughly would you say?
A lot of the time, I really prefer ladies to come earlier rather than later. And even if you come and see a women's health physio 2 or 3 weeks postpartum, it's not like you're going to be doing a full-on program. You're going to do like a reconnection. How is your scar doing? How is your breathing doing? How is just a simple activation of the pelvic floor doing? A lot of the time I might see somebody 2 or 3 weeks after birth, depending on capacity and baba and that sort of thing, and then leave you with a little bit of mini homework, 5 to 10 minutes a day for a couple of weeks, and then come back and return again. There's going to be different timelines. So when it comes to scar management, especially C-section, episiotomies, we're thinking, it's 6 to 8 weeks until we can really sort of get on top of the scar. We're doing things around it, but on top of the scar, and that will be graded differently. But you can start your reconnection, breathing, pelvic floor activators, pelvic floor into the abdominals and around this pelvic area 2, 3, 4 weeks postpartum. And then we just kind of progress it. Go. And I know this whole 6-week checkup and then going running after your 6-week checkup. We check you, yes, in lying down, but we also check you in standing and loading. We check symptoms versus what type of exercise that you're doing as well. And so there's a lot of research going on about impact or loading exercises, including running, jumping, all that sort of thing, and the postpartum period. Now, we thought it was 6 weeks. We know for a fact that the research says impact-wise, they would prefer nothing before 3 months. So that's 12 weeks, okay? And then even that, taking that into account, it depends on symptoms while you're loading, as well as the screening of strength and endurance. And it's pelvic floor, abdominals, ankles, quads, hips, rotation through your thoracic spine when you're running. It's all pressure management scenarios as well as so many other things. So when it comes to mobility and sort of getting back to feeling sort of more yourself, and it depends on what exercise you want to get back to as well. But I usually say to mums it takes 6 to 18 months to really build it up and do it with quality properly, like I said, so that we don't have those guys that are possibly less affected, just, taking on all of the load. And then the guys that have been affected muscle-wise, impact-wise, that they are just kind of switched off and in the background on holiday. We want everybody to be coming forward again.
Agreed. And I remember trying to go it wasn't even a run. It was like run for a minute, walk for a minute at about 11 weeks. And I felt like my insides were going to fall out of the bottom of me. And I had a really straightforward, easy birth. So it just really shows you take the recovery slowly, and it's definitely not a race. I wanted to circle back to different types of births and recoveries. So obviously you've got a normal birth where you've got no tearing, no nothing, pretty straightforward, which takes some recovery. Then there's tearing, episiotomies. Can you just talk us through all the different recovery processes and what normally requires the most care and attention versus what is just a normal delivery where you have no intervention or no stitches or no nothing?
Let's start with the simple one, that's the normal one. So as you said, this is the easiest one, I would say. So of course your pelvic floor still
needs some help
and all that.
That is regardless.
Yeah.
I think we need to get that super clear.
That's
Looking at pelvic floor, regardless of the type of bed.
But your skin or the vagina area won't be damaged. It's true that it's passed through kind of stretch and all that during the delivery with the head of the baby and all that, but it can easily go back to the normal shape. Then if there's a tire, we classify it in 4 grades.
Yes.
And 1, 2, 3, 4. So the 1 and 2 are the easy ones. The 1 only involves the skin, and the 2 involves skin plus muscle, little bit of muscle. So in these ones, the stitches can be painful. That area of the stitch, it could be painful when you're having intercourses. In case of if you're using tampons, also when you pass through the scar, you can have pain in there. Also, it doesn't help because when there's pain, you usually tension that muscle. So you are worsening that pain. So you have both things. You have the scar plus the tension, and then you are afraid of having pain again, and you contract more the muscles. So it's like never ending story, let's say.
What can you do in terms of pain management for tears?
So I would say go little by little.
Okay.
So for example, in the intercourse, try to go ahead very smoothly through them and not pressure yourself to have the same activity as before. Also, you can do some massage in the area. For example, once the scar is healed and all that, you can do some massage to yourself with your own fingers even, and a good cream. And once before going to bed, or when you have some minutes for yourself, is to try to smooth that area and also to reconnect your brain to that area and know, okay, now I'm going to go through an intercourse. I know that I have to relax that muscle there. So let's try it before we start and all that. Then on the other hand, the grade 3 and 4 means that they are near to the anal canal and they are affecting at some point or the anal canal direction even. And that means that when you are going to pass the stools, you will also have to do that mental connection, let's say. Yeah. So, of course, you need to go to the toilet every day, or every 2-3 days at least, and you will have to train yourself to do these. So, before even starting, what we do is to give the patient some laxative medicines to help the process. Once this is more or less healed and the scar is not that tender, let's say, then they can try by themselves doing all these things at home. So first, before going to the toilet, try to connect your brain with the muscles over there and try to relax all the area. And once all is relaxed, then try to push and try to pass the stools. If you do it very quickly or without having this care or being that careful, maybe you have pain or you can't pass stools, you have more hemorrhoids afterwards, so you can have complications. Yes. Yeah. So yes, as she said, the connection with our body is very important. Yeah. If you skip that step, it's like hitting a wall. You will never go to the next step. So you will be all the time having pain, discomfort, and all that. So it's better not to run, to walking slowly until you recover fully.
Before we start to round off today, speaking of advice, if there is a postpartum mum listening to this right now, what advice would you give them?
Okay, so I would say that I'm sure that they are doing perfectly, despite they don't think so, that they have to prioritize their self-care as much as they prioritize the baby's health and all the baby care. Also, I will say that they should have a good support on their families, friends, and the most important one, the partner.
Yes.
Because they cannot split the same in 2 or 3 or 4 people. No. So they need us for help. So let's go ahead for that. And when you face any of the issues we talked today about, be confident to talk with these about your doctor, about the mental health also. Ask for referrals for physiotherapy, for a mental health provider in case it's needed or it's crossing that area of the normal to the pathological things. And yes, also enjoy that time because it's also a wonderful, yes, it's a messy but beautiful time. So just go through it, enjoying as much as possible. And I think that they should prioritize themselves because most of the time they are focused on the babies and they are not hearing to their bodies. So that's my message for today.
Yeah, very similar. I think a lot of the time I just find that when we have expectations and when we have expectations on timelines and where I should be, that's really where my patients kind of feel like they are not where they need to be. And sometimes a lot of the time that's a timeline that we've, been online or seen with friends or seen with family. I would just ask them to kind of like just sit in the now, give yourself kind of the grace to reconnect. And it's not about, like you say, it's not about bouncing back. It's about meeting yourself where you are right now, void of expectations, like not thinking about where you should be or want to be at that specific time, but seeing where you are and seeing kind of, how are you going to possibly get to where you want to be? And that would be possibly by asking for help. Asking for how do I reconnect? A lot of the time with social media, everybody's kind of telling you how to do Kegel exercises, right? Or everything is about kind of like reactivating and squeezing. But a lot of the time we really find that ladies also need to be able to connect and relax just as much as squeezing, activating, increasing tone again. A lot of the time, and I just want to mention, yes, it's going to be, issues with the bladder and bowel. Rather seek help earlier rather than later. A lot of the time it can be something quite simple in the sense of it's not online because everything is tailor-made to you as a specific person. So like have the curiosity to find out, what is my specific sort of cause, and how am I going to kind of own this, and how am I going to reconnect and really kind of push towards what my goals are rather than just a trajectory. I wanted to also comment when it comes to pain, pelvic pain, sexual intercourse pain, pain with pap smears after birth, and I see this a lot, possibly when I see somebody 6-7 months down the line or a year down the line, or possibly wanting, they're pregnant with their second baba and wanting some birth preparation for the second vaginal delivery, which is the birth plan. A lot of the time then they are talking to me about, I really struggled with sexual pain for 6, 7, 8 months and I didn't know what I could do. And a lot of the time us as therapists, we will look at the whole picture. So how's the environment? A lot of the time with breastfeeding mums, because your estrogen is so low, your body is thinking about creating milk supply, right? Not thinking about sort of like really well kind of hydrating that area. And so a lot of the time we could even get leakage from the simple fact that the sphincter closure is not plump. It's not hydrated. It's more kind of dry. And so you can get leakage that way. But also with desire, arousal, pain, that's going to be estrogen. So a lot of the time I'll send back to the obs and gynae, and then some vaginal estrogen cream, especially while you're still breastfeeding. It really kind of optimizes that area so much more, helps with the scar healing. We talk about like creams that you can use to soften the scar, and scar techniques, breathing exercises, relaxing the whole area, but then also debating creates more of like a circulation kind of thing as well. Positions as well can make a huge difference. And these are kind of things that you can work out with your therapist.
I just think it's really important to clarify that pain is not normal. So if there's any pain anywhere, always seek help. And where can people find you if they want to come and say hi?
So clinically, I'm treating at City Mediclinic
Perfect.
Center.
And Dr. Maria, where can people find you?
So I'm based in Middle East Clinic, which is in the south part of Dubai, and also I do deliveries and other kinds of surgeries in private hospital. My main consultation is in Middle, so more than welcome to everyone there.
Guys, thank you so much for your time today. It's been really educational and informative. I've really loved speaking to you.
Thank you very much.